Good evening. My name is Gaman Jean, and my presentation is on the EVMS Connect4Health Wellness Coaching Program Communication Plan for Increasing Program Enrollment and Retention. In partnership with the Portsmouth Diabetes Prevention Project, in 2018, EVMS conducted a risk assessment to determine the rates of diabetes and diabetes risk factors in Portsmouth. The data showed that 75% of Portsmouth residents either had diabetes, prediabetes, or diabetes risk factors. 79% were either obese or overweight. And overall, 14% had diabetes compared to 10.5% of Virginia. In early 2020, EVMS launched the Connect4Health Wellness Coaching Program, which is a remote tailored intervention of the Connect4Health program launched 2 years prior to improve risk factors related to nutrition and physical activity behaviors for Portsmouth residents and to tackle the prevalence of chronic diseases. So what was the problem? The problem was public awareness and participation. The program's potential impact on community health could be improved with more awareness and participation among the intended population. A more concerted effort is needed to improve the program's outreach and encourage participation to impact the community's health. Therefore, the goal of the Connect4Health Wellness Coaching Program is to enroll 36 participants in the program by the end of June 2024 and to retain 80% of participants by the program's third session. The program wants to encourage participants to take control of their health because health is a team effort and a community working towards healthier lives will give participants the intrinsic motivation to maintain a healthier lifestyle. We also want to highlight the program's community and professional support and emphasize the long-term benefits of managing prediabetes and hypertension. The desired action is to encourage patients to continue to enroll in the program and to motivate healthcare providers to promote and facilitate patient continuous enrollment. We have identified 3 potential target audiences for the program. Our primary audience are patients ages 18 to 80 years old with prediabetes and hypertension who receive primary care at Portsmouth Family Medicine Clinic. Second are college students. Third are care providers at the clinic and the staff at the Consortium for Infant and Child Health, in other words, CINCH, and Portsmouth Diabetes Prevention Project. We have identified 5 objectives to complete our goals. 1, we want to provide 6 research internship and volunteer opportunities to college students in the South Hampton Roads area who are in the health-related fields. 2, we want to develop and distribute 500 pamphlets and flyers to patients at the clinic and community partners within the first 2 months. 3, implement target outreach with the clinic and community partners. 4, establish a follow-up system with staff and research assistants. And 5, address barriers to participation identified through feedback. We will implement these research strategies to ensure we have the necessary information to accomplish our goals. We have conducted a baseline survey to understand the current awareness and attitudes towards wellness programs. Research has shown that some demographics are less likely to participate in wellness programs due to historical factors. We have analyzed demographic data to tailor communication strategies. We want to ensure various means of communication are available to participants. We will regularly gather participant feedback through communication with coaches/research assistants. We want coaches to contact participants to ensure participants are meeting their nutritional and physical goals and to check on participants' psychological welfare. We also want to conduct pre- and post-assessments to understand participants' needs. To reach our primary audience, we will adapt a multifaceted approach using various communication channels. Through our internal channels, using digital platforms, we want to promote the program using pamphlets, flyers on the clinic, CINCH, EVMS, and community partners' website and social media pages. We also want to email newsletters to participants with registered emails. Through our traditional channels, we plan to engage our primary audience in the clinic This will allow us to directly engage with participants and provide them with all the necessary information about the program. Through our external channels, we will leverage the city's listserv service, which provides subscribers in Portsmouth with regular updates about local services and activities. By sending out notifications via email and text through this platform, we can reach a wider audience and inform them about the program. The Connect4Health Wellness Coaching Program is conducted through CINCH, a collaborative under the Community Health and Research Department at EVMS. CINCH receives funding from government agencies, contracts, and donations from people who support the organization's mission. It is a well-established organization with ample resources to support the program, eliminating the need for external funding to accommodate additional materials. This ensures a streamlined and efficient workflow, resulting in high-quality output and timely program delivery. As for the research assistants, the position is unpaid and provides research experience to college students. The team working on this project comprises of the director of CINCH, who oversees and manages the entire program, the primary care physician, who is responsible for the medical aspect of the research and ensuring that all protocols are followed and the safety and well-being of the participants are maintained, a research coordinator, who is responsible for coordinating all of the research activities, 6 research assistants / coaches working closely with the research coordinator to collect and analyze data, and finally, the admin staff, who provides valuable support to the research team. We have sent out notices regarding the research internship and volunteer opportunities through CINCH and have garnered interest for the positions. By the end of this semester, we will have selected the number of research assistants to fulfill the roles. Beginning in January 2024, the primary goal is to create various marketing materials such as pamphlets, flyers, and messages targeting our intended audience. This content will highlight the program's benefits and convince potential participants to enroll. During the second month, we want to distribute the pamphlets and flyers to the primary audience at the clinic and through the clinic, CINCH, EVMS, and community partners' social media pages and websites. This will help us reach a larger online audience. Additionally, we will notify people about the program through city listserv services in Portsmouth. This will help us reach those who might not be active on social media or have access to information through other channels. During the third month of the process, we will follow up with clinic staff to ensure they have all the necessary resources and support to provide quality services and to conduct biometric screening. We will also promptly monitor and respond to email and text notifications to address potential concerns or questions. During the fourth month, we will comprehensively analyze the various promotional measurements implemented, including the activities of the research assistants, clinic staff, social media platforms, newsletters, and community partners. The evaluation will encompass the quantity, quality, and effectiveness of the promotional materials provided to the intended audience. During the fifth month, in case of any issues, we will repeat the process mentioned starting in month 2, 3, or 4 if necessary. During the fifth and/or sixth month, we will conduct a comprehensive evaluation to determine the total number of participants who have been successfully recruited and have shown interest in participating in the program. This assessment will analyze the recruitment process and the various strategies to attract potential participants. We will send the pre-assessment, enrollment, and consent form via email and in person at the clinic to all the individuals who have expressed interest in participating. The pre-assessment form will collect demographic, nutritional, physical, psychological, and preferred contact information. The enrollment and consent forms will provide detailed information about the program, its purpose, and the procedures involved. Once we receive the documents from those interested and consented, we will send 36 participants an electronic copy of the signed consent form through our database management system. If there are additional participants, we will enroll them in the next phase of the program. During the program, coaches will establish regular communication with participants twice a week using participants' preferred methods of communication. This ensures that participants feel comfortable and confident in their ability to continue with the program. Coaches will be available to answer any questions, provide support, and offer encouragement, helping participants to stay on track and achieve their goals. Furthermore, we will conduct end-of-session assessments every 4 weeks to evaluate participants' progress. This assessment will provide valuable feedback on whether or not participants are meeting the nutritional and physical activity goals set by participants and coaches. So, for my conclusion, the Connect4Health Wellness Coaching Program wants to impact patient self-efficacy to improve lifestyle choices for diabetes prevention and management. Therefore, the goal is to enroll 36 participants in the program by the end of June 2024 and to retain 80% of participants by the program's third session. Lastly, we want the program to have multiple cohorts and be a continuous process. We also want patients to enroll in the program as they complete each cohort continuously. And this completes my presentation. Thank you for listening.